All right, yeah. Thank you. Keep the energy up. Just before we start, I would like to say that we have simultaneous interpretation. You have the headsets, English, Portuguese, and Spanish. So please feel free to use the language that you want. Good afternoon, buenas tardes, boa tarde. It's good to be able to speak our own languages as well here in Dubai. This is, as you know, a historic COP28. After 28 years, we finally have a health-dedicated day at the COP. And we have a health and climate change declaration that was signed by 123 countries, including many countries of the Americas. Thank you very much. Exactly, that's what we needed. Very timely. We are very happy to have the opportunity to discuss today the visions, the priorities, and best practices from countries and from leading agencies in the Americas in this agenda of climate change and health. First and foremost, I want to thank the Inter-American Development Bank for hosting us here, which is a privilege with a strong partner, and that we aim to continue to collaborate between the Pan American Health Organization and the Inter-American Development Bank. Well, I didn't present myself. My name is Daniel Bus. I'm the Unit Chief on Climate Change and Environmental Determinants of Health at the Pan American Health Organization. I'm based in Washington, D.C. We have a very interesting program, and with no further ado, let me introduce you to our wonderful panelists. I would like to start by inviting Mr. Ferdinando Regalia, who is the manager of the Social Sector Department in the Inter-American Development Bank, to share with us the visions from the Inter-American Development Bank on this agenda. Thank you, Ferdinando.
Thank you, Daniel. It's really a day after an historic day. It's my first time at COP. I led the IDB Social Protection Health Division for 12 years before becoming manager of the social sector. And I hope that now health is going to feature as a fixture of the next COP. We have a big responsibility. At IDB, our core principle is really partner with countries and with partners to support development, and climate health investment is part of this important engagement. We really would like to scale up our activities to make our health system more resilient and more sustainable. And we all know the threat that our health system, our population are suffering from climate change. Let me outline 3 ways in which the IDB is contributing to this agenda. And I treat them really as a starting point for the future, for our commitments in the future. First, I think we have developed quite a strong pipeline of projects, particularly in health infrastructure, in digital infrastructure. We are already embedding strong elements of adaptation and resiliency. For example, we are building hospitals in many parts of the region, from El Salvador to Honduras, to many states and municipalities in Brazil, in Bolivia, in Peru, where all the adaptation and the energy efficiency and the mitigation requirement are included. Second, like our other partners in the multilateral development banks, we are well poised to collaborate across sectors to improve the co-benefits of investment in this area. Let me give you an example. Last year we approved 2 important operations in Guyana, working in the hinterland. On the one hand, working strengthening primary health care, laboratory capacity, and hospital. All this infrastructure passed through the lenses of resiliency and sustainability. On the other end, we are contributing with another important investment in access to public housing, where new rainwater solutions are being adopted, studied with the community, because we know that this area is going to be prone to much more frequent droughts. And third, we collaborate with regional partners, and that's why we are so happy to organize this talk today with PAHO. It's really a privilege to work with PAHO on many areas. Let me highlight two, which are also part of this investment agenda. The last 6 years, we worked very closely with PAHO to support countries in the development of national digital transformation plans. And we believe these are important elements in the resiliency and sustainability agenda for the health sector. And today, in a few hours in Uruguay, a new alliance for primary health care will be launched, jointly with PAHO and the World Bank. This is another key element of this agenda. What do we dream to do in the future, at least on our side? And here we're going to hear later from Brazil and the great experience that Brazil already has implemented. We would like to support countries together with PAHO to accelerate their health adaptation national plan, both at the national level and the sub-regional level. Why did I say that? Why did I say that? Because coming from the health sector, in many cases, we fall far behind other sectors like transport, energy, with this plan. And therefore, talking to Minister of Finance, it's very important to develop this plan, to have them specifically with strong operational plans and costing, so that we can be ready to leverage more resources for the sector in this important path. So I really leave you with these three ideas. Very happy today of this talk, and I pass the floor back to Daniel.
Big round of applause, please, for Mr. Ferdinando Regalia. And I would like to invite to the podium to our Pan American Health Organization Assistant Director, Dr. Rhonda Seeley Thomas. Thank you.
Thank you. Hello? Hello? No? Thank you, Daniel. Good afternoon. Our partners from IDB, Ministers of Health, other persons from WHO, good afternoon, and thanks for the opportunity to address you. We have really been here over the last day and today in a truly historic moment where we've had the full day dedicated to health, and PAHO is really proud and happy to be here. And I want to again thank the IDB, our partners, for allowing us this space to address you. PAHO is committed to working with governments in building health systems which must respond to the health outcomes due to climate change, and to protect our peoples who are vulnerable to the impacts of climate change. And we must become more resilient, we know, in order to prepare and respond to the needs of our populations. As part of its climate change and health agenda for the Americas from 2012 to 2022, PAHO and its partners assessed over 400 healthcare facilities in the Caribbean for disaster vulnerability and environmental efficiency. This analysis has led to the rehabilitation or retrofitting of 50 facilities to meet energy, water efficiency, and disaster safety standards. PAHO is now measuring and conducting feasibility studies to reduce greenhouse gas emissions from healthcare facilities through clean energy sources in all of Latin America and the Caribbean. This is a paramount mitigation action that health systems will need to take, and PAHO is ready to support this process. PAHO, in collaboration with its partners, is also supporting member states to strengthen climate-resilient health systems across the region of the Americas. This includes strengthening health surveillance capacities and creating climate and health observatories, climate health early warning systems, and providing the technical support for the preparation of national health adaptation plans and health and climate country profiles. As the leading health agency of the Americas, PAHO has provided technical cooperation to train over 40,000 healthcare persons in the diverse disciplines in topics related to health and climate change. This includes capacity building for project preparation and implementation, climate resilient healthcare facilities, and climate resilient water and sanitary safety plans and more. To further strengthen our actions in climate change and health, PAHO recently created a new Department of Social and Environmental Determinants for Health Equity, DHE, and we have our department director here. This new department allows for better coordination of PAHO's response and technical cooperation on the social and environmental determinants of health, and a better integration of cross-cutting issues, including equity, human rights, gender, interculturality, intersectoral action, and community participation, strengthen our commitment to address health equity. In addition, we are pleased to announce that at PAHO, we were requested by its member states to prepare a regional policy on strengthening health sector actions on climate change and equity in 2024 to address mitigation and adaptation actions in strengthened health sector and to better respond with a health equity approach in climate change. This policy will prioritize groups in situations of vulnerability, and in the Americas, we have many persons who are vulnerable to climate change. PAHO would like to invite all of those of you who are here today and who would be listening to this panel discussion, the Inter-American Development Bank, PAHO member states, partners, and other agencies to support our policy framework for action on climate change, health, and equity. This is a call for a green and healthy recovery, which places the health of individuals of the planet, and particularly persons in the Americas, to foster a movement that will create societies focused on health and well-being. Now is the time for PAHO member states to recommit to regional solidarity and to strengthen our individual and collective actions to better promote our health and the health of our future generations, as well as the health of our planet. I am confident that we can achieve this, but we have to do it together, working with partners such as the IDB and with member states. So I'm looking forward to hear from our member states how they are building climate resilient health systems and how PAHO, together with the IDB, can assist you as we move forward. Thank you, and I'm looking forward to the discussions this afternoon.
Thank you very much, Dr. Silly Thomas, for presenting the PAHO strategy on climate change and health. And now it's also my honor to introduce you to Stella Hartinger. She's the director of the Lancet Countdown South America and associate professor of Cayetano Heredia University in Peru. If you can please position her presentation. Thank you very much, Stella.
May I be able to see my presentation?
I can ask.
That's okay. Hi, everybody. Thank you for coming. I'm really happy to be here presenting to you our findings from the 2022 report from the Lancet Countdown South America. I really want to announce that I need to move a little bit forward because I actually can't see anymore, okay? So I just move a little bit here to see my slides. But I'm happy to announce that we are no longer the Lancet Countdown South America, we're actually the Lancet Countdown Latin America. So our next year's report, we will include all of the Central American countries. So how does this actually, or how did we start? The Lancet Countdown is an initiative between the Wellcome Trust and the Lancet, the journal The Lancet, to track indicators on health impacts linked to climate change. We work through 5 strategies, 5 working groups. We want to track the impacts on health. We want to track if there are adaptation measures that are actually working or they're not working. We track mitigation strategies and health co-benefits. We track indicators that are linked to economics, and we track indicators that are linked to policy and public engagement. The Lancet Countdown Global is actually a larger organization than we are. There are more than 200 scientists with UN partners. We at South America, we are actually pleased because we only have partners that are coming from the region. We truly believe that if we work with people that are from a region, we can actually identify our priorities much better than if it's coming from the global. We work with 28 researchers and several institutions, including PAHO, that has actually supported us from the beginning. So thank you, Daniel, for that. You've been since we started in 2017, so thank you for that. We have 4 key messages in our report. The first key message is the adverse health effects of climate change are accelerating and disproportionately affecting the most vulnerable populations in South America. I don't think this is a shocker. Everybody knows this. And it will be exactly the same when we publish our next report. They will be in Central America, and the same for the Caribbean. Our second finding is understanding and assessing, tracking the health impacts of climate change and health co-benefits of climate actions, which are critical for the development of adaptation plans and policies. I want to stop here for 5 seconds. We just published a special issue to identify the gaps in our region regarding health, adaptation, mitigation strategies, economics, following the same structure of the Lancet. What we found and what was more interesting is that regarding adaptation measures, there is nothing published in South America about adaptation measures that have actually been implemented and have actually been assessed. So what we had to do is change our strategy. So what they had to do was actually change our strategy, and we went through all the NAPs on the 12 countries of South America, and what we found was that health was not considered in the other health sectors, in the other sectors. So health, for example, is not mentioned in the agricultural sector or the educational sector or the housing sector or transportation. So there is no way to advance the health agenda if it's really not considered. It's not something that is a cross-cutting theme throughout the whole sectors. The other big finding, it's interesting to talk like this, huh? It's very interesting. Okay, so another big finding was that there was a very clear baseline assessment of how health was impacted and why did we, it's like screaming, and they had to do the adaptation. However, in all of the NAPs, we could not find information that it was linked to who was leading the initiative, where was the funding coming from, and what are the progress indicators that they're measuring. So yes, we all have NAPs, but we don't have the people who are actually developing them, who is putting the money, and how are we going to assess them. So actually, this is a very big gap that we're going to follow now in our next report as well. Our third key indicator is that South America must accelerate efforts to mitigate its greenhouse gas emissions, to reduce land use change, decarbonize its energy and transport systems, and increase its use and production of renewable energies. This is the best way to actually have a clean energy transition, so we actually should focus on this component. And finally, we are implementing climate change adaptation policies and actions requires investments with transparent financial commitments and concrete budget allocations. So I'll go a little bit faster because I think I stopped too much. This is our framework. This is how actually Lancet Countdown looks at the impact. So we have the extreme events, which is similar to Caribbean. We have changes in precipitations and droughts, heat waves, and forest fires. At the end, we have our health impacts. We have our food insecurity, mental health, cardiovascular diseases, and infectious diseases. This one is quite important because from our indicators, we have not been able to develop a mental health indicator. We know it's going to be a big problem. It is a big problem now, but there's simply no information. So if there's a plea maybe to Pajo, it's how do we actually collect mental health information from our teens so we can actually create an indicator that we can track in the future. Another big problem that we're actually seeing is migration. There's no way to track migration within our populations, the migrants that are linked to climate. So this is another big information gap that we're finding in the region. And I'm thinking this is throughout the entire region. This is quite easy to understand. This is the exposure of populations to increased heat. It's just going up. In all the countries, everything is going up. And all the countries are suffering from 1 degree or 2 degrees, depending where you are. The biggest or the highest exposures to heat are in Brazil, Colombia, Uruguay, that we're finding in South America. This leads to an excess mortality of 160% in South American populations, which can also be translated to jobs lost, specifically in the agricultural and the construction sectors. We are also finding that climate suitability for transmissions of infectious diseases has increased 35%, specifically for dengue. And we see this increase really in all the Amazonian countries, Venezuela, Colombia, Ecuador, Peru, Bolivia, and Brazil. And finally, just the last one that I want to share with you is food security and malnutrition. We have estimated that the length of growing season has decreased, and there is a reduction in crop yields in all our crops. So really the future, what we're thinking is that we're going to see an increase in food insecurity that can translate to malnutrition in the future. So I'll stop here. So if you have any questions, I will be happy to answer them. It was really short. The report is quite long. So the summary, I hope the summary works. Thank you.
That was perfect, Stella. Thank you, as always. Thank you very much. So now, we see that our panel generated a lot of, emotion and excitement around. So thank you. Now I'd like to invite us for a second moment in our panel, which is to hear from countries' perspectives. So it's my pleasure to invite Dr. Yvette Berrio, the Vice Minister of Health of Panama. Dr. Paulo Gadelha, former president of Oswaldo Cruz Foundation, Fiocruz, and who is representing the Ministry of Health of Brazil. And Dr. Jerry Eichmans, the director of the Department of Social and Environmental Determinants for Health Equity of the Pan American Health Organization. So the dynamic here will be a dialogue, and Dr. Eichmans will moderate this part of the session. Thank you.
Thank you. Good afternoon. Bienvenida. So we're going to have a little discussion here, and also if you have questions or ideas, they are very, very welcome. We have here Brazil from South America, we have Panama from Central America, and we're really looking forward to hearing your perspectives from the countries. You're going to speak in Spanish, which is perfectly fine. You're going to speak in English, so it's going to be multilingual. So I would like to start, and we all talk a lot about, how climate change is already with us, but maybe you can talk a little bit about what are you already feeling in the health sector, in the health of the population from climate change. Maybe very briefly, because we're going to go more to the solutions in a moment. You have a microphone, maybe in your chair? Yeah, good. So let's start with Panama. Adelante. Yeah.
Muchas gracias. Primero agradecer la oportunidad de participar en este panel. Estoy emocionada porque estamos participando por primera vez en la COP de cambio climático, y esto es una oportunidad maravillosa para nuestros países, aprovechar toda la temática que se ha presentado durante estos días y pues recibir la información para poder ayudar a través de nuestros sistemas de salud a tener sistemas más fortalecidos y resilientes. Y por supuesto el contacto con las entidades internacionales, que también son de gran apoyo para que podamos nosotros implementar esos programas que a través del liderazgo de PAHO podemos nosotros trabajar y tener sistemas de salud resilientes. Perdón la insistencia, pero hacia allá vamos. Con respecto a su pregunta, nosotros, igual que el resto de los países de la región, hemos estado impactados por el cambio climático, y en Panamá principalmente hemos experimentado aumentos de casos de dengue, aumentos de casos de malaria. Por décadas hemos sido referentes del control de ambas propagaciones de estos mosquitos. Pero desde hace un año tenemos 3 regiones del país en donde los focos de dengue y malaria se han disparado, Y nosotros, que no lo veíamos venir o no lo esperábamos, hemos tenido que reactivar nuevamente nuestras políticas. Nunca la habíamos dejado, habíamos estado controlando adecuadamente todo lo que tenía que ver con dengue y malaria, pero el enfoque de COVID tal vez hizo que nosotros descuidásemos un poco el tema del mosquito y hemos estado trabajando en los últimos 12 meses en el fortalecimiento en nuestros equipos de vectores, pero consideramos que un factor importante es incluir a la población en toda esta programación de control de vectores, con la información, haciéndolos partícipes de la política de control. Y creemos y estamos completamente seguros que en la medida en que participemos con la comunidad e implementando las medidas de control y fortaleciendo nuestro sistema técnico, vamos a poder nuevamente lograr el control de la propagación del dengue y la malaria específicamente.
Muchísimas gracias, viceministra. Doctor Berio. El retroceso, ¿no?, que estamos viendo por el cambio climático, las cosas ganadas que estamos perdiendo nuevamente, un punto muy importante. Brasil, ¿cómo lo vas en Brasil?
Well, we're sort of living now sort of an exemplar negative case of the consequences of the climate crisis in Brazil. We are having a drought in the Amazons, floods in the southern part. We had heat waves in the central part of Brazil. And of course, this affects very differently the population. Because everybody knows in terms of Latin America and the Caribbean, this is the case of Brazil, we have a structural inequality. We have also fragilities in terms of not only the productive base, but also the question related to the economy, debt, and so forth. So, you know, this is a heavy burden. It's a tragedy. Guilherme was accompanying me here, and he is a specialist on the area of environment and health. He was in the Amazon and also in the other areas of Brazil. And it's a tragedy because you have people dying because the boats that would go to have the access for medical care can't reach them. You know, this is just one example, but it's very striking. Huh? And in the case of Brazil, I mean, we are, you know, in a very important transition period. We had the first national plan for climate and health. It was established in 2009. And then there was a discontinuity. There was a very negative period during the last government. And now we are returning. And I will explore later on, if it's possible, how we are shaping this with the main references. And also in one special question, which is integrating the health with the development programs of Brazil.
Thank you. Thank you very much. Sing it. Happy birthday. No, but thank you very much for putting the emphasis on those structural inequalities and how climate change and the droughts and the floods, etc., affect people disproportionately, and how important politics and policies are in this context. So we're moving now to the next question, and that is, so how are you already advancing in responding to the crisis that you are describing in mitigation and adaptation? Both Panama and Brazil are the countries that have made very important steps with the health national action plans. How is that going? What are your lessons learned? And maybe also, how are you working with other sectors?
Sí, es una pregunta sumamente importante porque consideramos que no lo podemos hacer solos. Una de las fortalezas es poder trabajar integradamente con nuestros colegas de otros ministerios hemos desarrollado planes de trabajo integrales para poder enfocar el problema, desarrollar unas políticas que sean efectivas para nuestro país, pero también el trabajo en conjunto con entidades internacionales, como lo mencioné hace un momento. Consideramos que hay un liderazgo en la región, hay una línea de trabajo que se ha ido desarrollando y fortaleciendo, y una de las entidades es la Organización Panamericana de la Salud. El trabajo en conjunto y el establecimiento de las políticas, tomando para nosotros lo que es bueno y potable para Panamá específicamente, porque si bien es cierto, el cambio climático ha afectado a todo el mundo, pero nuestras regiones tienen características sumamente importantes. Entonces, viendo nuestras características, adaptamos los programas a nuestras necesidades. Entonces, nuestro esfuerzo va en esas dos vías. Hacer un trabajo en equipo con los otros ministerios que tienen que ver con el cambio climático. Nosotros tenemos un Ministerio de Ambiente que ha hecho un trabajo extraordinario, no solamente para la adaptación, sino para enfrentar la situación que ocurre en nuestro país. Y quiero mencionar en este espacio, Panamá está experimentando grandes cambios en su selva por la migración irregular. Y de allí nosotros hemos experimentado que una de las áreas más complicadas con el brote de dengue y de malaria es exactamente la provincia del Darién, en donde se genera todo el tránsito irregular. Así que nuestro esfuerzo es justamente para mitigar. Si bien es cierto, respetamos la decisión de las personas de poder migrar, pero quisiéramos buscar alternativas para ayudarles a que no sea a través de la selva, porque esa no es una vía para transitar, es una selva y sus vidas están en peligro. Entonces nosotros hemos desarrollado una campaña informativa, hemos intentado establecer conexiones también con nuestros países hermanos de la región, principalmente Venezuela y Colombia, para que podamos entonces generar la información adecuada a los migrantes. En otro sentido, considero, y perdón si me extiendo un poquito, que todos los programas de investigación deben ser fortalecidos. ¿Cómo se reproduce el mosquito? Tal vez lo conocemos, pero hay nuevos criaderos en lugares inclusive inesperados. Entonces, toda esa información que hemos estado recibiendo es imprescindible canalizarla adecuadamente, desarrollando métodos investigativos. Y es allí también donde nosotros nos apoyamos mucho en los aportes de los organismos internacionales.
All right, thank you. No, muchas gracias por poner este importante enfoque en intersectorialidad, ¿no? Y que los problemas no son complejos, son muy complejos y se juntan. Entonces yo creo que eso es un tema muy importante y también que llama a la necesidad de más información, pero también más acción, ¿no? Gracias. Entonces, Brasil, ¿cómo les va a ustedes?
Well, first, we chose some main reference, of course, which are, the ones that the UN is fostering. One is the necessary connection between the climate change framework with the 2030 agenda. It's necessary to connect those. And this is also one thing in how health stands as a main point in terms of the 2030 agenda. We all know that universal health care is a proxy for the SDG 3 and it has connection with many other SDGs. But we think in terms of the universal health service as something very large in terms of its conception, of integrality, but also being part of this question that will address the social determinants of health in terms of the environment. And one crucial question thinking of this is how to connect the health area with the development plans. Minister Haddad was here at the COP and he launched what is called the Ecological Transition Plan for the Development of Brazil. And in this ecological plan, health is one of the very important areas. Another important aspect is when you think in terms of what we call the health industrial complex, taking all the areas involved with health. This responds, you know, that about 10% of the GNP. So if we move in a way that the health field fosters sustainability in this area, this will have a great impact, not only in terms of adaptation, but in mitigation. And again, when they chose the main axis for plans for development of Brazil, the health industrial complex was incorporated as one of the priorities. So we are moving in a sort of intersectorial way, but of course, in terms of health, the main question is the resilience of the health system. And the fact that we have a universal health system makes a lot of difference. There are important experience that we have in this area. All the major crises that we had recently, the health field have very strong impact in terms of going and trying to mitigate the consequence. And now Guilherme was just reminding me that we have from the Global Green Fund a funding for starting with a pilot program to choose 10% of the vulnerable population and start fostering the resilience of the health system. And this means in terms of capacity building, in terms of connecting the health vigilance to also the environmental vigilance. I may be extending too much, but you mentioned one very important aspect, which is the information. Lancet Countdown has a fantastic work and brings us, but I think that it's necessary to go deeper in some cases in two directions. The connection between climate and health needs more, and also the question of localization. Localization is crucial. And we are doing a lot of experience in Brazil for a long time, but now it's moving in terms of thinking of territories and having methodologies of what we call social participatory cartography of environmental and health sustainability. So we are doing this in a way that the action is directed to the reality, and because it's a participatory cartography, using images of Earth, using big data, you may already count with the population from the start. I think these are just some of the questions that were involved.
Thank you very much. And I think it's very interesting that both of you also mentioned the issue of participation. You know, that it's essential that we work with the communities, that we work in an intersectorial manner, that we put the focus on the localities, etc. So, and the territories. You know, as you also both said, even in one country, even in a country that's not so big, you have different realities, and populations have different realities. So now we've heard both from IDB and from the Lancet Commission. Are we really ready for the next big step? You know, if I ask you now, okay, what do you need? You know, because we all talk about we need more money, we need financing, but are we really ready to ask for that and how to do that? So that's my next question to you. Yeah.
Música para mis oídos.
I'm not saying there's a check waiting, but...
Porque considero que el tema de la adaptación es casi una obligación. O sea, reconocer la situación actual, evidenciar los puntos focales, hacer prioridad de ellos, pero también tomar acción. Y quisiera mencionar que en el caso de Panamá hemos iniciado un proceso de cambio a energía renovable en nuestras entidades de salud. Ya tenemos de 800 entidades de salud, tenemos 172 en los cuales hemos iniciado el cambio de la energía que se está utilizando a energía renovable. Y creo que eso es un paso importante que nos va a ayudar a enfrentar, obviamente, la situación climática que estamos viviendo. Porque esa situación es justamente porque nosotros lo hemos llevado al mundo a este punto. Y consideramos que para poder lograr los avances en la dirección adecuada, necesitamos del apoyo de entidades internacionales, que la inversión sea mayor para poder implementar adecuadamente y por supuesto que haya controles, o sea, se debe invertir, dar seguimiento y ver resultados, porque nuestros países tienen características muy especiales y necesitamos llevarlos al punto de los resultados para que las políticas que se implementan con la ayuda de las entidades internacionales puedan dar resultados específicos y positivos en la contención del avance de diversas enfermedades, justo que son el resultado del cambio climático. Así que para mí, aumentar la inversión, pero dar un seguimiento efectivo y ver resultados a corto, a mediano y a largo plazo.
Muchísimas gracias, ¿no? Es muy importante el enfoque en los resultados y de saber realmente dónde invertir para tener estos resultados, ¿no? Ajá.
Una cosita más, por eso lo importante también de realizar estudios, o sea, los estudios y la investigación tiene que ir de la mano con las políticas, o sea, no podemos nosotros iniciar un programa o implementar una política si no tenemos una base científica que nos indica cuál es el camino a seguir. Gracias.
Muchísimas gracias. Tenemos un par de minutos para que usted responda.
Okay, information is essential. We have here with us Cristóbal Barcelos, who's another leading specialist, and he is the coordinator of the Observatory of Environmental and Health of Fiocruz. And we have another initiative which is very important, which is funded by Welcome at Bahia, SIDAX, who has a really strong data, and it will be developing the connection between climate and health. I think, just as a final message, because there were so many things to talk about, I think Brazil is very conscious of the opportunity that it has in terms of being the head of G20 now, also thinking of COP 30. So, and President Lula is quite conscious that what will happen in Brazil will have also the possibility of a strong spread out effect internationally. So we need, of course, more information. We need funding. Sometimes they think that Brazil sometimes is sort of a purgatory. They say that it's a mid-development country. So, So it won't receive funds because it doesn't need, but we need funds. And we need most important of all, we need connections that integrating funds will make more effective the programs that we have.
Thank you so very much for this very important panel. And I think we're all looking forward to the G20 presidency of Brazil and to the COP that will be held in this region, because we do think that, the clarity that we have in this region about the importance, the relation between climate and health and how to move forward is going to be, is essential. So thank you, IDB, very much for being our partner in this, and over to you, and thank you very much for this wonderful
Thank you. A round of applause. Thank you once again, Ferdinando and IDB for hosting us. And thank you for being here today and for listening later on this online. With that, we close the session and wish you a very good COP28.